Hi and hello everyone. So this video is about the one important procedure. So first introduce myself. I am Mrs. M.Madhubala. I am working as a nursing tutor in E.S College of Nursing. So the topic is hot water bag application. So we will see what is hot water bag application. A hot water bag or hot water bottle is a rubber or thermoplastic container filled with hot water and used as a form of heat therapy to relieve pain, provide warmth and improve blood circulation. And what may be the purposes for applying hot water bag means, so we can relieve muscle pain, cramps or joint stiffness. We can use the hot water application for this muscle pain, cramps and joint stiffness. And second purpose is, so this hot water application, it provide comfort and warmth in cold weather, and it promote the blood circulation in affected areas. Yes, hot water bag, it promote the blood circulation and it will help through assist in relaxation and stress relief, and it alleviate menstrual pain or abdominal discomfort. And so what may be the indication for the hot water bag means muscle aches, back pain or joint stiffness and menstrual cramps. We can use the hot water bag during our menstrual cramps. For the arthritis and rheumatic pain, it will reduce the pain. And cold related conditions like hypothermia prevention and post-operative pain management and pediatric or elderly care with caution. And we will see the contraindication. So we won't use hot water bag application for this type of patients. So patient with open wounds or skin infection, it may worsen the condition. If we are applying the hot water application to the open wound and infected area, definitely it will affect the patient condition. And second contraindication is burns or sensitive skin condition. So for the burns patient, we can't use this hot water bag for the treatment purpose. And deep vein thrombosis, so we can avoid hot water bag application for this condition, deep vein thrombosis. So why means heat may increase the clot risk. That's why we want to avoid the hot water application for this deep vein thrombosis. And paralysis or nerve damage, so if we are using the hot water application to the paralysis or nerve damaged patient, it will reduce the sensation. It may leads to burns. Yes, paralyzed patient may have reduced sensation, so that may leads to the burns. And pregnancy, we can't use the hot water application to the pregnancy. And diabetes mellitus, so for the diabetes mellitus patient, we won't use this hot water application. It's a risk of burns due to reduced sensation. Paralyzed patient and diabetes mellitus patient have reduced sensation, so we won't use application for that type of patients. And we want to consider some points. What are all the points means? And do not use boiling water to prevent burns and rubber damage. We won't use the boiling water. And always wrap the bag in a cloth to avoid direct skin contact. We want to wrap the hot water bag with a cloth. And do not leave on one area for too long. Maximum the time duration is 15 to 30 minutes. So don't leave one area to the long period. And monitor patients with sensory impairment carefully. Check for leakage or damage before every use. And what may be the pre-procedure for the hot water application means, so we want to check integrity of the hot water bag, if any other leaks or any other cracks is there in the bag. And fill the bag with warm, not boiling water, warm water. The Celsius, normal Celsius is 50 to 60 degrees Celsius is recommended for the hot water bag application. So we want to use the degree 50 to 60 degrees Celsius. And expel excess air before sealing to prevent bursting. And wrap the bag in a cloth or towel to prevent direct skin burns. And explain the procedure to the patient and assess the skin sensitivity. So these are all the pre-procedure care. So we will see the intra-procedure care. So during the procedure, place the hot water bag on the affected area gently. Monitor the patient reaction for the discomfort or any other redness is happen in particular areas. So limit usage, that is you want to use 15 to 30 minutes per session. You won't keep more than 30 minutes. and reposition if necessary to prevent burns or skin damage. Yes, you want to change the position, reposition you want to do. And we will see the post procedure care. After the procedure, we want to remove the bag and assess the skin for redness or burns. Wipe the bag dry and store it in a cool and dry place. Educate the patient on signs of burns or overuse and document the procedure, any observation in patient records. So what is the responsibility? Nurse's responsibility in hot water application means assessment. So we want to assess and evaluate the patient pain level, skin integrity and conditions before the application. And preparation, fill the bag properly, check temperature and wrap the cloth. Application, place correctly and ensure patient comfort. And next one is monitoring, observe for skin redness, burns or discomfort. Education, teach the patient and caregivers about the safe usage and also the risk. And documentation, record procedure details, patient response and any other complication if arised. So you want to do this as a nurse, you want to monitor education and you want to document and assess preparation application. Thank you for your attention. Thank you.